What is a heart attack? It's a serious and life-threatening heart condition where blood flow to the heart is blocked. This slideshow is aimed towards adults aged 15 and older attending a community health fair who may be interested in learning more about heart health and preventing heart attacks. To make this presentation easier to understand, I revised my original presentation to enhance health literacy. I have done this by reducing medical jargon, simplifying language, and organizing content for clarity. The content in this slideshow has a Gunning-Fogg index score of 10.27, meaning it is written at a level that is readable to those with a high school education. In this presentation, I will explain what it is, symptoms that are associated with it, and ways to prevent it. I will also explain what occupational therapy is and how this type of therapy is beneficial for people who have experienced this serious and life-threatening heart condition. This heart condition happens when the heart muscles don't get enough blood, and so they start to die. Your heart needs blood to live, and a heart attack usually starts when something blocks one of your heart's blood vessels. This blockage is often caused by a buildup of plaque, and if that plaque breaks, a blood clot forms. This clot can quickly cause permanent damage to the heart within the first 30 minutes. When any part of your body doesn't get enough blood, it's called ischemia. So cardiac ischemia means a heart muscle isn't getting enough blood or oxygen. As you can see on this slide on the bottom right corner, there's a clot that is stopping the blood flow, resulting in a heart attack. And right above that, you will see that the blood vessel is starting to get a buildup of plaque inside of it, which is clearly showing that the blood is starting to have difficulty passing through it. Now let's talk about the symptoms of a heart attack. The most common sign is chest pain, but it's important to know that everybody can feel this differently and on different levels. So visiting a healthcare worker when this pain is not getting any better is important. These symptoms can sometimes be confused with things like coughing, stomach problems, or heartburn. This picture shown on this slide also shows the differences between men and women's symptoms, as they can be different sometimes. There are many other symptoms, and one may experience sweating, cool-looking pale skin, shortness of breath, feeling sick to the stomach or throwing up, feeling dizzy or faint, feeling weak, tired, or they may experience irregular heartbeats. It is important to note that some individuals may not experience any symptoms at all, which is commonly referred to as a silent heart attack. Many of the things that make you more likely to have a heart attack are related to your lifestyle choices, your weight, blood pressure, and cholesterol. Changing your habits can be hard, but it's the best way to protect yourself from having a heart attack. Here are some key ways to lower your risks. As you can see on this slide, one can follow Life's Simple 7 to help with preventing this condition. I will go into more detail about this in the following slides. So starting off with obesity. Being overweight, especially around your belly, can increase your risk. Extra weight can lead to fatty buildup in your arteries. If the arteries that carry blood to your heart get clogged or damaged, it can lead to a heart attack. The picture on the right side of this slide shows what a healthy artery will look like, with no difficulty for the blood passing through it. Whereas with plaque buildup due to extra weight, there is less room for the blood to pass. Another factor is smoking. Quitting smoking is very hard, but dealing with a heart attack is even harder. Smoking puts harmful chemicals into your body that can cause plaque buildup and block your arteries. These chemicals also damage the cells lining your blood vessels. And also sleep. Not getting enough sleep can raise your risk. Lack of sleep can raise your blood pressure and hurt your heart health. Good sleep is important for your heart, your brain, and your whole body. Being active is very good for your heart. Aim for at least 150 minutes of moderate exercise each week to help lower blood pressure, cholesterol, and weight. However, any amount of exercise will be beneficial. Even just 10 minutes a day can lower your risk by 34%. Eating healthy is very important for preventing heart problems. Try to eat a diet that's low in fat and high in fiber, and avoid foods with saturated fats. Eating healthy helps you control modifiable factors like cholesterol, blood pressure, diabetes, and weight. It is also recommended to eat foods containing vegetables, fruits, and whole grains. Those with diabetes are at a higher risk for heart conditions, especially if you also have high blood pressure, high cholesterol, you smoke, are overweight, or you don't get enough exercise. Diabetes can cause sugar to build up in your blood, which can damage your blood vessels. Also, stress can raise your risk of a heart attack. While it's hard to live without stress, try to find ways to manage it, as stress can raise your blood pressure and increase your risk of heart attacks. Occupational therapy is a client-centered healthcare profession that is used to help individuals with physical, sensory, and/or cognitive impairments. This therapy is administered by occupational therapists and is delivered by occupational therapists and occupational therapist assistants who help people from the community in returning back to their everyday lives, as well as regain independence in all meaningful areas of their lives. With the use of everyday activities, exercise, and other therapies, barriers that affect one's emotional, social, and physical needs are addressed and helped. How and why is occupational therapy important for this client population? Well, in occupational therapy, the occupational therapists and therapist assistants will work together with the patient and increase their level of independence. Heart attacks can limit one's ability to perform activities of daily living, but these therapists will help the survivors in regaining as much of these skills as possible. It will also help them adapt to any physical, cognitive, or emotional changes that were caused. 90% of heart attack survivors are subject to develop abnormal heartbeats, so medical management and different techniques will be taught to deal with this. Cardiac rehab programs must include components within each care plan: health behavior change and education, heart disease risk factor management, and treatments to protect the heart. Occupational therapy helps people who have problems with their bodies, senses, or minds. Occupational therapy treatments can include so many different things. So after a heart attack, the following treatments and educations are used for this population. Things like relaxation techniques will be taught, ways to complete things using less energy to reduce one from becoming tired, job support, ways to continue doing meaningful activities in their homes, patient and family education, and exercise. Finally, let's talk about how common heart attacks are. Understanding the numbers can really show how important it is to take prevention seriously. Heart attacks are responsible for over 15% of death rates each year. According to Canadian Chronic Disease Surveillance System, this heart condition is 2 times higher in males than females. Rates of heart attacks continue to climb in developing countries like South Asia, parts of Latin America, and Eastern Europe. Risk factors that can be changed are responsible for 90% of heart attacks. Reports show that the death rate is 4.6 times higher for adults aged 20 and older who have experienced a heart attack versus those who haven't. Each year, there are over 60,000 Canadians who suffer a heart attack, and according to CBC News, every 22 minutes, a Canadian woman dies from a heart attack. I hope this presentation gave you a better understanding of heart attacks and how to prevent them. Taking care of your heart is one of the most important things you can do for your health.